all across America and around the world. This is Veterans Radio. This is Veterans Radio.
Good day. I'm Jim Fausone. I'm the officer of the deck today here on Veterans Radio, and thanks for joining us. We've got some interesting stories for you. We always want to remind you you can find more about Veterans Radio at its Facebook site or at the web, veteransradio.org, where we're on the web 24/7. You can find a lot of our podcasts there as well. We post new ones every Tuesday, so you can get a new story, a new interview, something you didn't know before by going to veteransradio.org. And before we get started, we want to thank our sponsors. First up, we want to thank National Veteran Business Development Council, nvbdc.org. It was established to certify both service-disabled and veteran-owned businesses. You'll find out how they can help your business by going to nvbdc.org. We want to thank Legal Help for Veterans. Legal Help for Veterans fights for veterans' disability rights all across the nation. You can reach them at 800-693-4800 or on the web at legalhelpforveterans.com. And finally, PuroClean. PuroClean is the paramedics of property damage. It provides water damage remediation, flood water removal, fire and smoke damage remediation, mold removal, biohazard cleanup. It also has a focus on veteran franchisees. You can learn more about them by going to puroclean.com. We want to give you a little advance notice. We're going to have a Veterans Radio event on Sunday, September 28th, 2025. Radio on the River. We're doing a new location on Freedom River in Livingston County, Michigan. We want you to save the date. We're going to have veteran storytelling and guest speakers. We'll have raffle items, great local musicians and food. Also, uniquely, there's going to be an opportunity to fly in a UH-1 Huey from the Michigan Flight Museum. And maybe you can also win a free ride that way. But plan on supporting Veterans Radio either by buying tickets or sponsoring Radio on the River. Contact us at Dale@veteransradio.org or Jim@veteransradio.org to get more information, but we'd love to have you come out, and we'd certainly love to have you sponsor. We just want to remind you that Veterans Radio podcasts are available on all your favorite streaming platforms, including RSS.com, Apple Podcasts, Spotify, YouTube Podcasts, iHeartRadio, and Rees Across America Radio. So wherever you are, you can find us, whether it's on your mobile phone or your computer or your laptop, your tablet. But listen in to Veterans Radio Podcasts. We post something new every week, and you're going to find it informative. We want to welcome to Veterans Radio today from the National Association of Veterans Research and Education Foundation. It's CEO Rashi Romanoff. Rashi, welcome to Veterans Radio.
Thank you so much. I'm excited to be here.
Well, this is a great opportunity to talk about a hidden gem, if you will, inside the VA. But let me set this up a little bit. You hold a bachelor's degree in biology and public policy and a master's degree in healthcare policy and management. You've been a Fulbright Scholar, a Presidential Management Fellow. You've worked for the VA. You've been a Director of Operations for the VA Center for Strategic Partnerships in the Office of the Secretary. When you left there in 2017, you went to work for American Health Insurance Plans. You were the Executive Vice President of the Elizabeth Dole Foundation, which so many veterans know what good work they do. You've had a career focused on healthcare and veterans affairs, so this is sort of being CEO of NAVREF is sort of the perfect job, but I suspect nobody knows what NAVREF is. So let's start there.
I would agree. We're absolutely, it's in so many ways, it's a perfect job. And I love what we do. So NAVREF is what I often say is one of the best kept secrets of the VA. We are a membership association, and we represent the congressionally authorized nonprofit infrastructure that the VA uses to advance veterans research. So essentially, the easiest way to explain it is anytime you hear of an NIH trial happening at the VA, of a Pfizer or Merck trial happening at the VA, chances are all of that funding and all of that work is being coordinated by one of these VA affiliated nonprofits. It's an infrastructure that's been around for more than 30 years. It was, Congress and VA came together and in the late 80s really innovated this whole design of how the VA could work more effectively with the private sector. Because essentially, if tomorrow one of these pharmaceutical companies creates a cure for cancer, we want to make sure that veterans can be first in line to access that. And without these nonprofits and this infrastructure, there would really not be a way for veterans to be able to access these life-saving drugs. So we love representing this space. I think this public-private partnership space and ways to connect cutting edge emerging healthcare innovations, therapeutics, new drugs, being able to connect all that to the VA and the federal government is a really, really exciting place, especially right now. And so NAVREF sort of sits right in between that ecosystem and tries to make all of this easier.
Well, it is important right now in particular because VA just celebrated its 100 years of medical research that's really focused on veteran-related issues. That's kind of a milestone not many people can point to, is it?
Absolutely. So, and it's not uncommon. Sometimes when we talk to people, there's a little bit of, wait, VA does research? And you're like, yes, not only does it do research, but it has this rich tradition and rich history of doing research that's not only benefited veterans, but has really advanced American public health for all Americans and all citizens of the world. The VA research program, as you rightly noted, it turned 100 years old. My joke that I often say is that it doesn't look a year past 97, but it turned 100 years old this year. And so we spent a lot of time really raising and celebrating all of the amazing achievements that the VA has celebrated in this last century. So, things like the pacemaker, the nicotine patch, they did the first successful liver transplant. So many examples of how the VA has really been on the precipice and cutting edge of research and new drugs and new therapeutics. But more recently, these aren't all just things from like the 60s and 70s. More recently, things like psychedelics research, which is in the news a lot. VA is pioneering the work that's happening there. Recently, there was a really great news article about VA researchers actually doing the early work to isolate GLP-1s that are used in things like Ozempic and Wegovy. So when you think about, all of the achievements that the VA has done over the last 100 years, and then you start to contextualize that in terms of what the next 100 years could look like, especially when you think of how much data the VA has. And the future of healthcare is really going to be around how we're using data effectively to empower local physicians and local decision making, and really be able to better predict disease. And I cannot think of a system that is better poised to lead on this than the VA, which is the largest integrated healthcare system.
It's that piece of it in particular is particularly fascinating in that you have this huge population that the VA's got data on. Now it's mostly men, but that's changing over time. But the million veteran push, hey, we want all this data so we can ultimately more personalized treatment by segmenting it more clearly than just male, female, old, young. I mean, it really has a unique data set. As computers get better, AI gets better, researchers get better. It's got to be a treasure trove for researchers.
Absolutely. It's over 9 million enrollees in the VA healthcare system. You mentioned the Million Veteran Program, which is the world's largest and most diverse genetic biobank, again, in the entire world. And to say nothing of the fact that, one thing that I think makes the VA so unique, the ability to do longitudinal studies at the VA.
Now, wait. Explain what longitudinal studies for those of us who did not get a Fulbright scholarship.
Well, longitudinal studies is essentially just these long-term, multi-year multi-generational, even in some instances, studies. When we think about things like traumatic brain injury or a toxic exposure or cancer or Alzheimer's, dementia, things that progress and change over time, the VA holds on to patients for years, if not decades. Now, people's interactions and sort of level of engagement with the VA might change over time, right? When they're working, they might only go to the VA for certain kinds of appointments, and maybe they go to a civilian or their, employer insurance provider for different things. But in a lot of instances, the VA is having engagement with their patients for years, if not decades. So the ability to be able to study, well, what does, toxic exposures and the progression of this look like over a lifetime is really unparalleled. And, traumatic brain injuries in the news all the time. And it changes over time, right? If you have a TBI in your 20s or 30s, how that manifests and changes in your 40s, 50s, and 60s looks very, very different. And there's no other system in the country, if not the world, that's really able to monitor this progress and study disease progression like you can at the VA.
And just to put some more context in this, I have an article in front of me from Task and Purpose. It says in fiscal year 2024, Congress appropriated $984 million to the VA for 102 research sites nationwide and nearly 7,300 active projects. Those numbers are astounding. Unless I read them here, I would never, if somebody had asked me, how many do you think? Talk about the scope of all that and where NAVREF sits in on that.
Yeah, so it's a great question. And what I would say is, that 984 million that you cited, that actually doesn't even include extramural funding, which is what NAVREF really supports. So on top of that 984 million, our members facilitate annually upwards of $300 million a year on clinical research. So the way that I say it, just to make it easy, is about $1 in every $3 that the VA is spending on research is actually coming from an external partner, right? It's a place like the NIH. DoD is increasingly investing in the VA for research as it relates to service member health. The pharmaceutical industry, biotech sector is increasingly coming to us saying, hey, we really want to leverage data. We really want to work with you. State and local governments, philanthropy. So places like the Prostate Cancer Foundation made a historic $50 million investment into VA research over the last few years. And so, you're right. I think it's when people often say, like, so tell me what's going on in VA research, I say it's my most favorite and hardest question to get, because it's almost easier to say what's not happening in VA research, right? There's just so many opportunities and fields of study. Now, what I will say, what the VA has done, I think, over the last, 5 to 10 years is really making sure that they're focused in on those issues that are most impacting veteran populations. And so VA's Office of Research and Development has really taken on an enterprise optimization plan where they're really ensuring that those resources are going to the areas where we know veterans are really struggling, right? Areas like mental health, behavioral health, suicide prevention, traumatic brain injury, PTSD, cancer, aging, dementia. So it's really, really fascinating to be able to take a step back and look at what's possible. And then I think, from the perspective of NAVREF, because we sort of sit in this bridge with the public and private sector, where does it make sense for the private sector to really leverage the VA for the testing of new drugs? So like cancer is perhaps, the oncology program is perhaps the biggest area of interest, right? Because we know that veterans have a higher incidence and prevalence of cancer, either as a result of their military service or as a result of other factors. So places, it's a great place to come and study things like lung cancer, prostate cancer. We have such higher rates of that, unfortunately, within the veteran population. And so oftentimes you have a lot of interest from the, manufacturers and the drug developers of those cures and of those life-saving interventions to really want to, come to the VA and figure out how can we design these interventions to really best serve the veteran community.
It's for those of us in the veterans world and are familiar with terms like presumptive conditions, Parkinson's, ALS, and we've had the chance on Veterans Radio to talk to the leaders of the Parkinson's Foundation and the ALS Foundation about how they help veterans. But part of this is sort of it's that swinging door between civilian population and veteran population. Do you see the pushing out from VA or pulling in from VA on those kind of issues?
Yeah, and I think that tends to be one of the biggest questions right now, really is, it really comes down to where people are accessing their care and how they're able to connect back to some of these benefits that they really only get at the VA. And so I think it's, one of the things that I think is really interesting about all of this is, the bedrock of VA research is really rooted in partnerships. And that partnership is really between leading academic medical centers and the VA. As is often quoted, the VA trains more than 70% of the nation's doctors, right? And so the benefit of this system, not only do you have veterans, I think, moving in and out of the system, we also have providers moving in and out of the system, right? Chances are, if you're at the VA in Durham, you're doing some sort of appointment or seeing patients at Duke as well. And so it's allowed so I think not only as patients are moving in and out of the system, you also have this movement of providers, which has allowed the VA to bring in the best and brightest of academic medicine to treat veterans. I think as veterans are seeking out care in the community, I'll be honest, I don't think that's going anywhere. I think when you sort of see what's happening with the budget and in the news, I think community care is an element that's going to be here for a bit. So what I think we're really focused on is how are we working with those community care providers and those systems so that when a veteran goes out into the community to seek care and maybe, something happens on a lung cancer screening or something happens with a breast cancer screen, how are they connected back to the VA so that they can still be enrolled and connected with all these research opportunities that they're really only going to get at the VA?
Yeah, there are some things VA does much better than the civilian population because its cohort of patients have a higher incident of that thing, and therefore they are more experienced, more trained, more focused on recognizing it. We're talking to Rashi Romanoff, CEO of National Association of Veterans Research and Education Foundation, better known as NAVREF, NAVREF. Put a .org on that and you can find the website. How did a nice Pittsburgh girl like you end up so focused on veteran healthcare and research issues?
Yeah, great question. If you would have told me, 20 years ago that this is what I'd be doing, actually, I don't know. I don't know that I would totally believe it. But, I think going through grad school, going through, all the formal training, I knew I wanted to do something around impacting healthcare. Honestly, thought I might end up at a place doing more, global healthcare, global women's health, things like that. And when I was a presidential management fellow, just going through a job fair, if you can believe it, in DC, met someone at the VA and they, said, "Hey, so what are you interested in?" And, I said, "I really want to work in healthcare, but I want the work to make a difference. I want to be able to feel the impact." And they said, "Well, have you ever thought about working at the VA?" And I'll be honest, like many Americans, I was like, I didn't really know that much about the VA.
Nope.
I did not come from a military family, so it was a bit of a black box to me, which I think is helpful now in this job when you think about explaining this to other partners. And so when I started to think about it, largest integrated healthcare system in the world, the ability, and it's a national leader. If you figure something out in the VA, it is going to become a national, if not global standard. And the ability to transform healthcare policy and the delivery of healthcare at that level for a population that has so earned the highest quality of healthcare. I can't think of another patient population in the country that deserves the highest quality of healthcare than our service members and veterans. It just sort of checked all the boxes. And I think the ability, and I think there's also, I'll just say this, I think particularly in this environment that we're living in Washington, I often say this feels like the last bastion of an issue that has wide bipartisan support. One of the things I used to say at the VA, which still stands true about working in this space, I love that you don't really know the political affiliation of anyone you're working with in these circles because everyone is so hyper focused on serving veterans and serving their families. And I can't think of a better North Star when you're going to work every day. And so it's really honestly reassuring to work in a space where not only you feel like you can have an impact, but there's such wide support around doing the right thing and wanting to get this right, and knowing that getting it right is of critical importance, that it makes partnership so much easier.
Well, let's transition from there. It's a good jumping off point because research is a long game. And we've just talked about VA's been at it for 100 years. As NAVREF looks into the future for research, there are certainly economic concerns, but talk about why this is so important in the long game aspect of it.
Absolutely. So I love that research is a long game. I think I'm probably going to steal it. It is a long game and it's a team sport. That's our other line that we say. You need a lot of different entities supporting and sort of rowing in the right direction for biomedical research to really be successful. When you talk about, I'll give you one example of something that shows that research is a long game at the VA. Back in the 80s, and the New York Times recently published on this, so I'll give credit to them. But back in the 80s, there was a VA researcher at the Bronx who was doing all this work on lizards and lizard venom, right? And it was this really interesting story of, okay, like why are they doing lizard? And they were saying essentially the premise being you don't really see a lot of overweight lizards. I wonder what's going on here. I wonder what's happening in sort of their biology and in their systems to allow all this to happen. They did all this work. They got lizard venom. They isolated all these compounds. Fast forward, this VA researcher at the Bronx isolated the GLP-1 compound via lizard venom.
Can I stop you there? Because it would be so easy to look at lizard research and call it fraud, waste, and abuse.
Absolutely.
You have to keep the long game in mind in research.
Long game. And the reporting is really great. And it was interesting because there's a line in there. Now I will say, wearing my VA hat, there's a line in there where the researcher actually brought it to the VA and said, hey, I think there's something here. And there's one line in the article that said the VA was like, oh, I'm not sure that there's a benefit here to veterans. And then fast forward, the GLP-1 is Ozempic, Wegovy, like all these different medications around diabetes and weight loss, and is really transforming how we're thinking about chronic care management in the United States. And so an example of something that started as maybe an isolated project in the 90s, now, 20, 30 years later, having this huge impact in how we think about diabetes is fascinating. So it is a long game.
One of the interesting things, too, about VA healthcare and VA research is the world of clinical trials. And I don't think the general public, most veterans, understand kind of what clinical trials are about and why that's so important as a segment of VA managed care. Can you talk from NAVREF's standpoint about clinical trials and the value?
Yeah, absolutely. And I think, if there's one thing I think the beginning of 2025 has really showed us, and this is, I think, beyond just the VA veteran space, is that I think the world of research has to do a better job of explaining what it is they do. I think there's a lot of things that people don't understand about how all of this is organized. And so I will say, for the purposes of clinical trials in the VA, access to clinical trials and clinical research is a fundamental component of high quality care. There has been research that's been published that says institutes and research centers that are doing research have higher quality of care output, right? A big part of it. So, what I often say to civilian populations is, if God forbid somebody gets really sick and they say, okay, where do you want to go? People might say, oh, I want to try to get to the Mayo Clinic. I want to try to get to the Cleveland Clinic. St. Jude's is a really good example in the pediatric space. When you dig into that and you say, well, why those places? And it's usually, oh, well, they have doctors there that will get me into some trial or some life-saving medication, right? And that is exactly how we should be thinking about the VA. So not only, clinical trials are the opportunities for veterans and patients to be able to access new emerging treatments, new emerging therapeutics. Some of these new drugs, when you think about things like radiation oncology, may allow you to defer things like surgery or painful chemotherapy. There's newer therapies that are available that might suit the veteran and the patient and their family more adequately. Drugs that have a higher efficacy rate, right? A higher likelihood of being successful. So there's a lot there in terms of the benefits to the patient. What I'll also say, and this is a bit more of a systems thinking, but research is also one of the most compelling things we have to offer providers and young physicians that are looking for places to come. Oftentimes when it comes to recruitment, being able to say, not only can you come here and be, a clinician and see patients or an oncologist, but you will also be able to access all of this data and do cutting edge research and publish papers and transform care. That's why a lot of physicians and clinician scientists get into this field, right? They want to find cures to these diseases. And so not addressing sort of the connection of all this stuff to, research isn't a nice to have. It's a critical component of high quality care. But from a systems angle, without research, being able to recruit physicians and nurses and all these, it's going to become much, much more challenging for the VA.
Well, if a doctor or a scientist in that realm wants to have the opportunity to be challenged and use their scientific creativity to something useful, and that's why it's a great recruiting tool. But when we've talked to researchers and doctors at the VA, oftentimes they're saying, well, okay, let me give you the phone number or the email address where you can link up and see if you qualify for the clinical trial. One of the things VA Scope does, it's really it's a national scope. So we do these, and somebody from California can get in, or Maine or Florida or Alaska, which you may not get in a more localized healthcare practice. So I always found that kind of interesting that there's a pretty big reach on this, isn't there?
Absolutely. And, I often say VA made investments into things like telehealth back in the 90s when it was not the sexy thing to be thinking about. They invented things like the electronic medical record when it was not the trend hot item to think about. And so the result is that now, 20, 30 years later, there's such a robust technological infrastructure. So things like VA's tele-oncology program, they're sort of headquartered in Durham, but the physicians working on that are seeing patients all over the country via telehealth. And so in what other system is that possible for you to be able to get the best and brightest of, cancer leadership and cancer expertise in a small town, potentially in, North Dakota via telehealth? It's amazing.
Well, we really appreciate the time you've given us today, Rashi Romanoff, CEO of NAVREF. If people want to know more, and maybe we're gonna get a couple of VA researchers say, yeah, maybe I should join up, or corporate partners, where do they go to get some more information?
Absolutely. So we always direct everyone, come to our website, www.navref.org, NAVREF. Reach out there, email our team if you want to get connected about ways to learn about how you can get involved in VA research. We have a number of resources available on our website around, things for PIs and researchers who are trying to learn more about extramural research, ways to get involved. So just reach out to us. If you're a veteran who's interested in learning more about research, also let us know. Things like the Million Veteran Program are always looking for people to get involved. And if you're really passionate about research or want to learn more, we're happy to connect you locally to some advocates that can really help get you connected into these trials.
Well, NAVREF's doing very important work supporting the work that VA is doing in research, which is very important work. So, Rashi, thank you for the time that you've given to Veterans Radio today.
Thank you so much, Jim. It was great to be here.
And I want to thank everybody for listening to Veterans Radio today. I am Jim Fausone. It's been a pleasure to be your host. I'm a veterans disability lawyer at Legal Help for Veterans, and you can reach us at 800-693-4800 or legalhelpforveterans.com on the web. You can follow Veterans Radio on Facebook and listen to its podcasts and internet radio shows
by visiting us at veteransradio.org. That's veteransradio.org. We again want to thank our national sponsors, the National Veterans Business Development Council, nvbdc.org, Legal Help for Veterans, a veterans disability law firm with a national practice before the VA, can help you on your claims and your appeals. It can be reached at legalhelpforveterans.com or 1-800-693-4800. And PuroClean, a leader in property emergency services. It's the paramedics of property damage, providing water damage remediation, flood water removal, fire and smoke damage remediation, mold and biohazard cleanups. You can reach them at puroclean.com or 800-775-7876. We also want to thank our local sponsors. This would include the Charles S. Kettles chapter of the Vietnam Veterans of America, that's chapter 310, VFW Graf O'Hara Post 423, the American Legion Irwin Preskin Post 46 in Ann Arbor as well, the VA Ann Arbor Healthcare System, and certainly the National Vietnam Veterans of America Association. You can be a sponsor by going to veteransradio.org, clicking on the About Us and our sponsors, and help us out. Keep this program alive for the 21 and 22 years. Keep us going for another 20. Thank you.